the area's top public health experts issued a warning and a plea this week. If we don't take all the precautions now, East Texas could be the next area to be overrun by cases of COVID-19.
If you haven't received it already, we've seen a lot of people doing this, but if you haven't gotten it already, please get your flu shot today. This is one of the best measures you can take to protect yourself from the flu, and also potentially, we don't want you to potentially have the flu and COVID-19.
We're ready. So at this point, we're doing well. We are seeing the highest number of cases we've ever seen in the hospital. We want that number to decrease because that's what we can do safely in our communities, is to keep those that are vulnerable from having to be admitted to the hospital. We can provide great care, not just COVID care, but all care across the spectrum. It doesn't matter whether it's orthopedic, cardiovascular, neurologic. We need to be able to provide that care for our communities. People do not need to stop coming to see their doctor for illnesses. We need to have them continue to come to the hospitals. And our hospitals are safe, healing environments for those patients and families, whether or not they have COVID-19.
We know there will be another surge of cases. Christmas will come, New Year's will come, and as people come together and gather, those become spreader events. So what I would really encourage people to do is to avoid those big family gatherings. As hard as that may be, as much as we love to see our family, I've got family I haven't seen in over a year, but I don't feel like I can safely go see them in other states because I could carry it to them. And so I would ask you to think long and hard, think twice about big family gatherings, big group gatherings, big Christmas parties, big New Year's parties, because we can all safely say that those will become spreader events.
There are millions of doses which are in production now. Of course, many of these vaccines require 2 doses, so we'll need a lot, millions and millions of doses of vaccine. But with limited doses coming in, the state is prioritizing populations for receipt of the vaccine. And the first group, they call it Tier 1A, will be healthcare workers. Those on the front lines, putting their life on the line in many cases, will be the first earmarked for that. And gradually over coming weeks or months, others will be in line to get the vaccine. And so probably will be around April-ish or thereabouts before it comes in sufficient quantities where everybody, whoever wants the vaccine, can receive it.
So the question is, what's one thing that's causing the surge to happen? I would submit to you that it's COVID fatigue. If you go around the community, you're seeing a lot more people out and about. You're seeing activities. People basically we're, as I said earlier, we're 8 months into this. And we were early on, we had a shutdown, people stayed home, but people are ready to get back to their normal day-to-day lives right now. And the reality of the situation is that, while we have fatigue, the virus is not fatigued with us quite yet.
I think staffing is a concern for every health system in the country currently, between fatigue, burnout, stress, their own illness, and the continuing volume of patients that are coming in. Like Christus, we're doing everything in our power to hire, recruit, train, identify nurses who can move up a skill set. The RAC has been very helpful as well across our division. A number of our hospitals have been able to get some help. However, the holidays are coming, and some of those folks are going to want to break as well and be at home with their families for a little while. So I think all of us worry about it. We do all the things we can to protect our folks and to lift them up, celebrate them when we can. But yes, it is a concern. And again, as the numbers continue to surge, as our staff watch people do the things that we're asking people not to do, and then they're getting sick and coming in, that's another level of frustration that I think my medical staff, our nursing staff, our respiratory therapists, and all the others really struggle with. And so again, we're asking people to do the right thing by their community, which will help the staffing issues in the hospital as well.